Hi guys, it's me, Deja. Today I want to talk about how to pass the NCLEX PN in 75 questions. So a little bit about me. I actually graduated 2 years ago, 2019, from my LVN program. This is all when COVID was happening, so I never really got around to taking my test. Fast forward to June or July of 2021, I ended up scheduling my test and I failed. Yeah, so I got the questions are 75 to 145. So I got all 145 questions the first time and I walked out of there. I knew I failed. I didn't know what I was doing. I didn't know anything on there. And I had listened to Mark K, but I just listened to the lectures. I didn't do any practice questions. I would definitely recommend doing practice questions. So you have to wait the standard 42 to 72 hours, whatever. I got my test back and yeah, I knew I failed. I cried. I was so sad. And I said I was going to give myself some time to study. And that's exactly what I did. So I scheduled my second exam, my second attempt for December 13th, Monday, December 13th, 2021. To prepare myself for my second attempt, I did a lot of practice questions. I listened to Professor D on YouTube. I can link her, one of her videos below. She was very thorough with her questions and her rationales. She was very thorough with her rationales. And I loved her questions, and immediately I seen a lot of the same type of questions that were on my first attempt. Going into the second attempt, what you have to know is priority, delegation, patient safety, what's going to kill the patient the fastest, physiological integrity, and then you want to know your basic. And then, you want to know your basic. And then, you want to know your basic. And then, you want to know your basic disease processes. What does this disease do to this part of the body? A little bit about my test. So my second attempt, I did pass in 75 questions. I felt a lot better leaving the testing center. I felt like I passed. I felt like I knew a lot of the information on there. I felt like I answered a lot of it right. I had select all that applies, and a lot of it was what not to do. Like, the patient is going through this disease process. What would be something to tell them not to do? So I had a lot of that, which I found pretty easy. So yeah, anybody out there that is, attempting to take their NCLEX again, first time, second time, definitely do Professor D. Do some practice questions. I actually have a practice book with some questions in it that really helped me. Know your lab values, of course. Thank you.